So with that, I will ask LAO if they have any comment on BCPs 1, 3, or 4.
Great. Thank you, Madam Chair, and Senator Monty and Mark Newton with the LAO. We do recommend approval of these 3 budget requests based on a review. Just one issue we did want to note for the committee. Whenever there is a budget request for funding for a grant program or for a service, regardless of funding source, one thing our office always assesses is whether the amount of funding that's allocated for the administration, state administration of those funds is kept to a reasonable amount. And what stood out in these 3 proposals on the SNAP-Ed proposal, the amount for administration did seem at first blush to be somewhat high. It's about 30% of the funding is going for administration. But based on discussions with the administration, we have an understanding of the relatively complex federal administrative requirements and a federal direction that we beef up the state oversight of the funding. So the amount does appear appropriate based on those needs.
And when you do that analysis on the admin rate for a grant, do you factor in what the grantor allows? Because some grant makers have a cap or embedded in the grant is a maximum amount a percentage of the whole grant. So is that factored into your analysis, or you just look at it from a plain across the board state admin perspective?
And from any sort of legal requirements too, like for instance, in the state's administration of bond funds, state general obligation bond funds, a typical requirement now in recent bond measures is to actually cap administrative expenditures to make sure as much goes out the door as possible. So we look at the sort of the workload, any federal requirements, any legal requirements, and big picture.
Excellent, thank you. Finance on any of the 3. Public comment on budget change proposals 1, 3, or 4.
Madam Chair, Senator Monning, since I'm already in the room, I will just express our strong support for these. Thanks.
Thank you, sir.
Me too.
Beautiful. Senator Monning, I would entertain a motion that we accept the budget change proposal request for budget change proposals 1, 3, and 4. Thank you very much. So noted.
And thank you very much.
Thank you. With that, we will move to our 7th and final item, which is advocate proposals. We have 3. 2, 7A and 7B. I'll ask Mr. Kelch and Ms. Jones to both come forward together, all those who will be speaking on behalf of the advocate proposals. We'll start with 7A, the California Association on Area Agencies on Aging, and have you present your request.
We'll start with Clay Kemp, Executive Director of the Seniors Council, which serves Santa Cruz, San Benito, Monterey, and Santa Clara counties. And I'm here representing C4A, California Association of Area Agencies on Aging, and presenting that proposal.
Excellent, thank you.
Just some quick background on why we did this. Essentially, AAAs are responsible for delivering services to the aging community on the local level. We do a comprehensive planning process so we know what our community needs. Santa Cruz is very different than Los Angeles. It's very different than Alturas or rural areas of the state.
Absolutely.
So we try to maximize the use of the dollars locally. Through that process, all of us are realizing we have to do something about the aging of the community. There's 1,000 individuals a day turning 65 in California. And maybe more importantly than that, our managed care organizations are telling us that about 75% of their healthcare costs are coming from 8% of the population. And the majority of that 8% of the population are older adults or people with chronic conditions. So we see this tsunami of healthcare going up as our population ages. And what are we going to do about that? We can't stop people from turning 65, but what we hope we can do is help people who do turn 65 age with independence and age with good health. So out of that, we put together our budget proposal, and we tried to focus on categories that would have the biggest impact to help the entire population, and recognizing that some people are probably going to age pretty healthily and others are going to have greater challenges. So we ended up with the 4 categories that you see in the proposal. Access to services and coordination of those services. We want, if people don't know where the services are, they may as well not exist. And then we want to make sure they're coordinated so that they're used effectively. Also, nutrition is kind of the obvious one that I think everybody gets, and I don't have to say a whole lot about that, but if you don't eat healthy food, you're not going to age in a healthy manner. Caregiver support is a recognition that the majority of senior care in our state is provided not by professional caregivers, but by family members, and we want to support that. And we also want to acknowledge some volunteer programs that are out there, such as the Senior Companion Program, that provide very low-cost care to seniors in their homes and keeping them independent. And then lastly is elder abuse and prevention. It's a little different than healthcare, but we think it's equally important. Obviously, we don't want our seniors to be abused in any way. Our elder abuse proposal includes the ombudsman proposal, which is also a supplemental request on here, so we certainly acknowledge that. A couple things in those strategy areas that I do want to highlight is that a lot of the focus in these programs are at programs that use volunteers extensively, which drives the healthcare cost down. Meals on Wheels uses volunteer drivers. Brown Bag does the same thing, plus volunteer food collectors. Senior Companion is a volunteer program itself. The family member component is another piece where essentially you have default volunteers, and then Ombudsman uses extensive use of volunteers as well. So that's kind of the backbone of what we have proposed here. We believe that these programs conservatively will save the state $135 million or more per year for the $37 million investment. We tried to conservatively estimate some of those savings. The actual position paper leaves out some of the savings, which we could go back and recalculate, but we tried to make the targets that we describe in there realistic so we weren't overselling them. Lastly, the other thing that I'll just close with, unless there's questions, is that most of these programs are either in place now, but exceeding, not able to meet the capacity that the demand is requiring of them, or they're programs that were proven to be successful in the past that ended up closing due to the budget crisis we've just been through, but they would be easy to bring back because the infrastructure and knowledge about how to provide those services, plus the familiarity of the aging community to start using the services if they start up, is there already. So we think it could be a pretty quick turnaround to success.
Yes. You want to wait till Mr. Couch finishes? Okay. Mr. Couch.
Yes, Madam Chair, members. I want to paint a little bit different picture of this growing number of seniors, and that's from the point of view of poverty. And regardless of how we measure poverty, California has one of the highest rates for seniors in the nation. A couple years ago, the Senate Human Services Committee and the Assembly Human Services Committee had a hearing that focused on poverty and its implications on seniors. So the issue of poverty and its relationship to seniors is well documented. Poverty has serious ramifications among the seniors: hunger, poor nutrition, isolation, lack of information, how to get access to services, being vulnerable to abuse, lack of coordination among services, which incidentally is one of the core functions of an area agency, poor health, depression, the need to use the emergency rooms higher than many of the population. So area agencies, if I can, provide more than just meals. That's what area agencies generally are best known for, Meals on Wheels. But there's a lot of services that area agencies do provide. We not only serve the 4.5 million seniors in the state that are above 65, but the focus is on those of low income. So, whether it's providing assistance, core coordination, medication management, family caregiver, respite. These services really are needed out there, and the area agencies are almost the safety net in providing these services to our seniors, particularly those that are in poverty. We ask that you look favorably on this request and fund these important services. Thank you.
Thank you very much. LAO or Finance, any comment on the proposals? LAO.
Yes, just Madam Chair and Senator Monning. We are currently reviewing all advocate proposals and remain available to the subcommittee and its staff to provide any technical assistance to assist it in its evaluation.
Excellent, thank you. Public comment. Oh, let's let them go ahead and do it. No, sorry, we'll do it twice.
Madam Chair, Gary Passmore, Congress of California Seniors. I would be remiss not to share with you the fact
She's on the next
that,
floor, right?
and Darrell was very good at talking about how seniors are affected by, and in California, enormously affected by the cost of living and their own poverty. You should also know that California is aging faster than almost any other state in the United States. We're in a strange situation in which California's post-war population in the late 40s, early 50s exploded because of our economy. And those folks are now entering 65, 75 years of age. So we have a big issue. And what we call the old, which is people over 85, are the fastest growing component, percentage-wise, among the aging population. And they are the highest need, highest acuity for all the services that Darrell mentioned. So we're facing some serious challenges in the decade or so ahead. And these are really very, very small investments to start the process of meeting the needs of this population. We urge your support.
Good afternoon, Lisa Coleman with CalCOA, the California Long-Term Care Ombudsman Association, and we are in support of C4A's ask.
Thank you. Next witness.
Debbie Toth, Rehabilitation Services of Northern California, Contra Costa County. I am in support of this ask and then some. I'd like to point out that the chart that you got in your handout with the reductions that you see that's happened over the last 4 or so years in Department of Aging does not include programs that were eliminated, like linkages, the Alzheimer's Daycare Resource Center. These are also asks that floated through the Assembly, and I'm sort of missing how there's a lot of different asks that are going on, and these at a minimum absolutely are important asks, and we're in 100% have supported them. But I think also we need to look at the bigger picture of how the senior safety net has been absolutely annihilated over the last 6 years in this state. And as we start to turn that ship back around, while we still have some infrastructure left, we really need to look at investing in it. Thank you.
Point well taken. Next witness, please.
Hello, Denise Leiker, SCAN Health Plan Independence at Home, Los Angeles County, as well as the MSSP Site Association. I will meet too my colleague Debbie Toth, as well as add, as we look at things like even the MSSP program, there is an ask also for program stabilization for funding, because this population, as already stated, is growing and in need. Thank you for your consideration.
Thank you. Appreciate it. Next witness.
Bob Campbell, the program director of the Senior Companion Program in Santa Clara, Monterey, Santa Cruz, and San Benito counties. We have about 5,500 hours of volunteer time, senior companions doing companionship services as well as respite services, and the result is a decrease in our clients' hospitalizations, the time they spend in emergency rooms. It gives their caregivers a chance for job retention and improves overall access to healthcare systems. In that 4-county area, the average of our average income of our volunteers is just about $12,000 a year. Through the Economic Elder Security Index, they estimate that in that area to actually be self-sustaining, be able to afford rent, be able to afford food, be able to afford health care and transportation, costs about $24,000 a year. By providing support to this budget action, what you do essentially is you close that gap because of the services that are available in that for those people. Though they don't have the income, they are able to get to services that make up a difference between what they actually make and what they actually need. We really urge your support of this budget action. Thank you.
Thank you. Next witness, please.
Hello, John Balutz. I'm Executive Director of Health Project Center, and we run MSSPs for Santa Cruz and Monterey counties, as well as the Caregiver Resource Center, also funded through Department of Healthcare Services that works with family caregivers. And I would like to strongly support the C4A ask. The programs support clients of MSSP, of family caregivers, really those who need it the most, and it's really important safety net for our communities, and we've really suffered with many of the cuts to long-term care services that have happened. I also want to say that the MSSPs are really in a position that we need money to keep the programs going through the transition. It's been flat funded for years and years and years, and I am fearful that our ability to go forward has not only been harmed by the loss of other long-term services support, but the inability of the state to provide the funding to make sure those programs go forward during this time of transition and not leave vulnerable seniors hanging. Thanks for the opportunity.
Thank you. Appreciate it. Next witness.
Hester Kleinstecker with the Office of the State Long-Term Care Ombudsman. We support the C4A proposal and very much appreciate C4A including funding for Ombudsman program elder abuse investigations in this proposal. Many of you may not be aware of this, but our local Ombudsman programs are required by state law to investigate elder and dependent adult abuse occurring in multiple facilities, some of which we cannot use federal funding to cover because they are not included in the Older Americans Act as long-term care facilities. So adult residential facilities, adult day health care, all of these places, we are responsible for investigating reports of abuse. And we really need the state funding to do this. Thank you.
Hi, I'm Cheryl Simcox with Ombudsman Services of Northern California. Strongly support this ask. It's vitally needed for every population that was discussed. Thank you.
Susan Fila of Jewish Family Service of Los Angeles.
And Nancy Volpert of Jewish Family Service of Los Angeles. And we strongly support this proposal as a valued partner with the AAAs in LA County. We are a provider of many of the services that were described. We do, however, ask that you look to match the proposals that were put forward on the Assembly side, which include additional funding for MSSP and some other services that were not, there's not an exact match as was mentioned earlier. And we think there are some critical components on the Assembly proposal that should be incorporated as well.
Hi, Teresa Ogun with the MSSP site here in Sacramento, Placer, and Yolo counties. And again, we also support the C4A funding. And I want to remind you of the clients who came this morning, the seniors who presented this morning, and to think about them as you also think about stabilizing that program, the MSSP program, and with some funding to help do that. Thank you.
Very much. Appreciate your participation. Thank you. We're going to hold that item open. Again, we'll move now to hear from Karen Jones, Executive Director of the Long-Term Care Ombudsman Services, San Luis Obispo County.
Hi, thank you. I was warned on Friday that I'd be the last speaker of a long day, so I'm going to try really hard to be brief so you guys
We've been longer. This is a short one.
I know.
Yeah.
I thought I'd be on the road at like 7 tonight, so I'm actually kind of happy too. So it's my own benefit to be somewhat brief. I just wanted to remind that in the 1970s, your former colleagues are the ones who helped to approve the Ombudsman program, to establish it here in California, along with the federal folks who saw the benefit of having an organization that would be able to be the voice of care facility residents, to be the advocates for those people. And we've been going strong at that job since 1978. In California, our Ombudsman program is kind of uniquely situated versus some of the other states in that we have a state Ombudsman program, part of the Department of Aging, and then we have local programs that aren't really state agencies, although we are tied to them. So we have different types of Ombudsman programs throughout the state. Some are based out of counties, some are based in nonprofits, some are based in nonprofits but have other services that are also provided. So it's a really unique challenge. And as we keep telling people, our only consistency in California is our inconsistency. And it makes a challenge for us as well as people out in the community. But all of us share the same services. We all investigate care facility problems. We all try to resolve those problems. We all provide facility monitoring visits to make sure the facilities are providing their services correctly and that residents are being heard when they have an issue. We also investigate problems of elder abuse in care facilities. As Hester pointed out in public comment just now, that's a mandate of California. That's not a federal mandate, and there may be some issues with the federal folks on that also. We also witness advanced healthcare directives, which is also a California mandate, and we provide information and referral for folks on long-term care facility issues. We are sometimes compared to licensing agencies as if we were like maybe licensing light or the no-calorie version of licensing, and we truly are not. We are a reactive advocacy agency trying to prevent problems in care facilities. The licensing agencies, by their very nature, are reactive. They wait for the problem to happen. By their very nature, this is what they're designed to do, and then come in and decide if there was a violation of a licensing regulation. So our job isn't licensing regulations. Our job is the human beings who live in those facilities. We're there to make sure they're treated like human beings and like we would all want to be treated if we were, unfortunately, in a care facility ourselves. Last time I was here in March, you guys heard the story I told about the resident who we prevented from being evicted, saving the state of California thousands of dollars between Department of Health Care Services and also Department of Public Health, had that eviction gone forward. And I won't regale you with that same story because, you know, again, I'm the last speaker of the day. But I did want to point out that even in a smaller complaint, just this last Monday, I was in a facility, and I don't know if you're aware, but some people who have had a stroke or some other issues, they have to have their liquids thickened, which try not to do that. It's really gross. But there's some stuff that's added to fluids like water to make the stuff thicker so it doesn't, when they swallow it, doesn't go into their lungs. And I was in a nursing home and I observed a staff member adding water to thin down the thickening stuff, which is sort of the opposite of what you're supposed to do. And it wasn't that the staff person was trying to be evil incarnate. It was just she didn't want to go get more of it from the central supply closet. She didn't have a lot of time. So she added some water to make it last enough to fill up a couple of pitchers and call it done. However, if I hadn't been there, if I hadn't observed this, I wouldn't have been able to stop her from doing that, because what it did was thin the liquid down, which would have put an awful lot of the elderly people who can't swallow regular water into the hospital with aspiration pneumonia. So, because that's what happens, the stuff goes into their lungs if they can't get it down their throats in the stomach, which is where we like to keep that stuff. That complaint, if it had gone to licensing, hoping that nobody got hurt, would have cost the state of California at least $700 to $1,000 minimum to have somebody come from licensing to come investigate that complaint, to look at all the facts and the findings, and then to send out the information. It cost me just a few minutes of time, and it saved an awful lot of suffering for the residents. And again, the staff person wasn't trying to be bad. She just was busy and did something not so bright. So I want to point out before I stop, so you guys can run away, that this is what we do every single day. It's hard. I don't know exactly how C4A came up with their numbers, but it's very hard to say we save the state money. Here's exactly what that dollar amount is, because how do you determine what the cost value is of something that didn't happen? But we can look at what it would cost to have them come, and that's our best way of figuring it out. And I would say that we save the state money. That's not our goal. Our goal is to do what we need to for the residents. But, you know, as a side benefit, the state can save money. That's my dollars too. Those are my taxpayer dollars. And I understand the pressures you're under, but we're not asking for very much. And the Ombudsman program, we want to do our job. We want to make sure every program in every community has the ability to do what I did, because right now they don't all have that ability. They're not in those facilities doing those visits. We need to get back there and do that. So I urge you to approve the funding request that we've presented, and I'll answer any questions. Thank you.
Thank you. So the $2.8 million for the 45 positions would be statewide?
Yes.
Senator Monning?
Thank you, Madam Chair. First, I want to thank all the advocates who have stuck around today, and particularly to comment on these, and then those who are panel members, at least two of whom are constituents in the 17th Senate District, so I want to thank you for your work. A question on the first information that Clay shared, and I think this was described, but the bullet point 3 says respite purchase of services. Yeah, I understand that's respite care services to help a family member who's maybe caring for a family member with Alzheimer's so that they can have a Saturday break, and correct me if I'm wrong, but I think most of that is a lot of the respite care services are supported by volunteers, as well as whatever minimal funding can be mobilized. Is that accurate?
There's two pieces in here, actually. Respite purchase of services is a category in Older Californians Act, and it actually is a paid caregiver position. So you're also correct, though, in asking the question about volunteers doing the same thing. The senior companion volunteers can serve as volunteer respite providers who in many ways do the same thing as a paid caregiver in allowing the family member to go out, go shopping, go to the doctor or whatever. Sometimes you just can't find the volunteer, and sometimes the level of care that the individual has is so high that you really need a paid professional to provide that respite.
Thank you. And I guess the other way to use the term volunteer is that often the ongoing care is a family member who's not being compensated, and then this respite, there may be a mechanism for a paid person to come in, but all of this still at great savings to the state. And I think in your comments, Clay, you mentioned this 37 million could save as much as 135 million for the state. And I might have missed it, Ms. Jones, but you also mentioned a savings, obviously, from the Ombudsman program. Do you have any projections of if this funding proposal, this budget request, were funded, any way to extrapolate savings to the state?
It's very challenging, like I said, to figure out what didn't happen so it didn't incur a cost. And it's not as if I'm saying, you know, if you give us this money, you can take it away from, say, Department of Public Health, because, well, they would not appreciate me saying that, and I wouldn't. But it's in what it saves the Department of Public Health and Department of Social Services and their licensing components. We know that the Department of, well, both of them have had some rather negative reviews. There have been some challenges with both licensing agencies, particularly Department of Public Health, who is, 11,000 complaints behind on their workload. If we can investigate another 20,000 complaints a year because of this money, that's workload that doesn't end up on their shoulders, and they're not coming back to you saying, gosh, we had these 20,000 more complaints. And they're at a much higher cost, you know, being a state agency and not being able to utilize volunteers like we are. That's where we look at the savings right there. But to give a dollar amount, I'd have to look a lot more through their own finances, and sometimes they're hard to read.
Right. But I think it's fair to say these dollars invested do save longer-term dollars. Did you have another comment, Clay?
Yeah, regarding that, I mean, that was one thing that we had a difficult time quantifying also. But there's one other piece that I'd just like to add is we're also saving law enforcement responses to some of the more serious calls. And locally, we have a lot of sheriff and local police support of the Ombudsman program for exactly that purpose. And then the other thing that I would just add to that story is, at what price is elder abuse okay? And I don't need to answer that for you.
Right.
We all agree it's not okay at any price, and I think Ombudsman is a very affordable way to make sure it's minimized.
Thank you. And I know we're not taking action on these today. I'm curious to hear the other public comment. Just a comment, though, for Department of Finance. I think we know it's hard to extrapolate savings. I think one of our big frustrations when we were looking at huge deficits and making massive cuts and trying to prioritize those cuts, I think we were often frustrated when we would try to ask Department of Finance what would be the out-year increased costs based on certain cuts when we were trying to figure out how to prioritize tough cuts across the board. So it would be my hope that as we move forward with this conversation and these recommendations, I would hope that Department of Finance would do its best to try to provide the administration with some of these touch points of, while this looks like more strain on the general fund, I think it would be in our shared interest and the administration's if, as part of the breaking down these proposals, if there could be some rough estimates of savings, if you reach that conclusion as well, and that, I don't know what timetable we're on, but if any of that could be reflected in a May revise, that, yeah, this is an increase in what had been anticipated for general fund costs, but it's going to save the state money, and it's money well spent. When you look at our huge budget allocations, these just seem like very modest recommendations that come back tenfold in terms of unquantifiable volunteer support and community benefits. So that would be my request of Department of Finance.
And I would say ditto, and it doesn't always have to be out years. I mean, we've made requests, for example, when we looked at the elimination of adult day health, and we said, show us on the other side the uptick in skilled nursing facilities and other places where we know these people are going to have to go. So sometimes it's in the same year where you can show, because I know the budget is kind of built sometime with blinders on. We're looking at the fiscal year in front of us. So even if it's not out year, if you could show us in another area of the budget immediately, like in the law enforcement or whatever the case may be, where there's savings. So I completely concur with that request. Before I open it up to public comment, Ms. Jones, I just want to understand the positions for the monitoring visits and the investigations. Are those positions mutually exclusive? If I'm a monitor, can I also do investigations?
Yes, you could do both if you were an ombudsman. And
Okay.
Certainly the Los Angeles program would love to have you.
I would be good at it, too.
Yes.
All right. Thank you very much for bringing forward the proposals. LAO, Finance.
John Silva with the Department of Finance, and just to respond to your comments, Senator Monning, we have met multiple times with the advocates on these proposals, and the long-term savings are definitely something that we look at and try to keep in mind when we're meeting on those proposals. So happy to continue discussions with the advocates and can provide any technical assistance to staff as it's needed.
That's good to know that that's a part of your menu. Thank you for that. Public comment, I'd ask you to keep it as brief as possible.
Good afternoon. I'm Lisa Coleman. I'm the Executive Director with California Long-Term Care Ombudsman Association, and I would like to point out that last year, the Ombudsman across the state investigated 16,000 complaints in skilled nursing facilities and only referred over a little over 700 of them. We are very pleased that the governor is putting money into the Department of Public Health and the Department of Community Care Licensing. We believe we are the third leg on that stool, and that we can do a good job to help get these departments back on track, doing the kind of work that they are best suited to do. Big, heavy hammer for big problems. So we ask for your support in restoring and allowing our programs to do what they do best. So thank you for your time and consideration.
Thank you very much. Next witness, please.
Nicole Wertelman on behalf of the Ventura County Board of Supervisors in favor of the funding for the Long-Term Care Ombudsman. At minimum, the funding will help to address the elder abuse problem, which is rapidly growing, and it will address it early in the game.
Thank you. Next witness.
Members, Gary Passmore with the Congress of California Seniors. In the words of the song, you saved the best for last. This is our #1 priority. And I should also report to you, they're not here today, but AARP are in support of this issue. Just a minute, I'm trying, CALA, the Assisted Living Association, is in support of for the Ombudsman. And a number of others. I think you'll be getting a letter with logos and all of that on it, but we're not alone. You've seen me a lot of times up here today, and we care about a lot of issues. This is the first and most important.
Thank you, sir.
Esther Kleinstecker with the Office of the State Long-Term Care Ombudsman. I think Karen expressed everything very well, the issues that we're dealing with. I wanted to add a little something about being a volunteer program. We currently have about a little over 100 paid, full and part-time paid staff in the program, and over 850 volunteers. The more funding that we have for paid staff, the more volunteers we can support with that paid staff. And it's the volunteers often who are out in the facilities and seeing things and dealing with issues before they get to the point where licensing needs to be involved. So I hope you'll keep that in mind. Thank you.
Thank you. Next witness.
Good afternoon, Aaron Lewis with the Consumer Federation of California, here in strong support of long-term care ombudsman's request. It's been touched on before, but a very absolutely essential program for oftentimes voiceless and vulnerable community. Thank you.
Thank you.
Madam Chairman and members, my name is Terry McCown, and I'm a regional ombudsman coordinator with Sacramento and Yolo County. We have the largest number of facilities in this northern county. We have about 1,200 facilities, and I have right now 15 volunteers. That's it. So I'm sorry I don't have some figures from the finance aspect, but from a cost-benefit analysis, possibility of, let's say that licensing or Department of Public Health, a one-year annual salary is $50,000. If I were to just get a little slice for 10 volunteers that would save $50,000 from preventative measures, that's saving $500,000. And that's just a tip of the iceberg. So we're really not asking for a lot. So thank you very much.
Thank you. Appreciate that.
Hi,
Final
Cheryl
word of the day.
Simcox.
Make it a good one.
I'm going to try to. Ombudsman Services of Northern California. I just want to, we're the 4th largest program service area in California. We cover 7 counties, which is Sacramento, Yolo, Yuba, Sutter, Placerville, Sierra Nevada. We have almost 850 facilities and 20,000 residents. The staff members we have to respond to the complaints and try to make monitoring visits and train volunteers are approximately 3 to 3.5. Sacramento County alone has almost 560 facilities. We do a lot, we need to do more, and it's cost effective, so please support that. Thank you.
Thank you very much. Appreciate it. Thank you, particularly to the advocates, for your proposals and the work and effort that you've put in to developing them. We appreciate that. Senator Monning, any closing remarks for today?
No, just thank you, Madam Chair, and thank everyone who's been here today.
Okay, I want to thank the departments, sergeants, and all the staff for the work you do every week to pull these budget subcommittee hearings together, and we will see everyone next Thursday. Subcommittee 3 stands adjourned. Thank you.